The bones in the hand are present in various regions and they are named differently. The bones, first they are present in the wrist area. They are the small cubical bone having 6 surfaces. They are termed as carpal bones. They are in the wrist area. The bones of the hand are termed as metacarpal. The first one is highly mobile. This is the first metacarpal next to the thumb, and the fifth one is next to the little finger, whereas second, third and fourth will be next to second, third and fourth digit. These palm of the hand consist of bones called as metacarpal bones, whereas the bones of the digits or the fingers are called as phalanx. There are 3 phalanx in each of this finger: the proximal, the middle and distal phalanx, whereas thumb has got only 2 phalanx, the proximal and the distal phalanx. So total there are 14 phalanx, 5 metacarpals and 8 carpal. You can see the same thing in the skeleton of the hand. Here, these are the 8 carpals. This is the first, second, third, fourth and fifth metacarpal. It's the hand. These are the 2 phalanx of the thumb, and these are the 3 phalanx of the remaining digits. Okay. So let's see the carpal bone in detail. So this is the first carpal bone, the proximal row from lateral to medial. I am teaching how to know it's lateral. This is the radius, so this is lateral. Okay. So this boat shaped bone over here, which you can see, I'll point with my index finger. Please observe this one. This boat shaped bone, so you can see it's clearly like a boat. It's called scaphoid bone, meaning boat like bone. Each of these carpal bone has got 6 surfaces. So obviously 6 surfaces means anterior, which is facing the front, posterior, which is behind, lateral and medial, and proximal and distal. Proximal faces radius, distal faces the next row of carpal bone. So scaphoid bone is a boat shaped bone. It is present on the lateral aspect of the proximal row. Next, moving on to this bone. This bone is called lunate. You can see it's like a moon. Can you see it's like a half moon? It's called lunate bone. It is just medial to the scaphoid bone. Okay, that's lunate bone. The scaphoid and lunate articulate with the radius. You can see that lower end of radius to form the radiocarpal joint along with triquetral. I will show you the next one. So this bone is triquetral. I will show with my thumb here. Say this one. You can see it's like one triangle or a pyramidal shape, no? Therefore called triquetral bone. Again, they are roughly cubical. They have 6 surfaces. Overall outlook is like a triangle. Therefore it's called this one, triquetral. Sitting on the triquetral, can you see this tiny bone here? This tiny bone is called pisiform bone. It's sitting on the triquetral bone. It is actually a sesamoid bone which develops in the tendon of flexor carpi radialis at the age of 11 to 12 years in a child. Okay. So proximal row of carpal bone, I will revise for you from lateral to medial: the scaphoid, the lunate, the triquetral, this one, triquetral, and the last pisiform, this one, pisiform. So that's the proximal row. 4 bones are over. Next, the distal row of carpal bones include trapezium. It appears like a kaju barfi or rhomboid shape, diamond shape. Okay. So this one. That's why it's called trapezium. The next bone is trapezoid. This one. That I am showing from the thumb, na? That one. That is trapezoid bone. It is roughly similar to trapezium, but it's like trapezium, not exactly like trapezium. Therefore, it's called trapezoid. Means trapezium like. This trapezium, interestingly, it articulates with the first metacarpal of the thumb to form first carpo-metacarpal joint. All the carpo-metacarpal joints form a single synovial cavity, whereas the first carpo-metacarpal joint is an independent synovial cavity. The importance of this I can show you in my hand. See the first carpo-metacarpal joint is moving here at the wrist. It moves the thumb independent of the other finger, whereas the other fingers, if you try to move, one finger if you try to move, the other fingers also moving, and you can't move them together. You can't move them independently, that's what I meant. Together you can move, but not independently like this thumb. And interestingly, the pulp of the thumb touches the pulp of the other finger. This movement is called apposition. Apposition is done because of thanks to the first carpo-metacarpal joint, individual synovial joint. I'll show you this one. Between the trapezium and the base of the first metacarpal. This first carpo-metacarpal joint permits independent movement. So I finished with trapezium and trapezoid. Moving on to the largest carpal bone in the body is this one. This is called capitate. In fact, this is a carpal bone. It's developed as early as 2nd to 3rd month of intrauterine life. Okay. So this carpal bone, capitate. It resembles a cap, therefore called capitate. Last but not the least, this one. The medial most in the distal row is hamate. It is called hamate because it appears like a hammer. Carefully observe. So it appears like a hammer. See, this one, body of the hammer. This is the head of the hammer. See, the hook of the hamate. This portion appears like a hammer, therefore called hamate. So we have the 4 bones in the distal row, 4 carpal bones from lateral to medial. I will name them trapezium, trapezoid, capitate, hamate. So this is the distal row of carpal bone. Whereas the hand bones are metacarpals, they are 5 in number. The first metacarpal, first is for the thumb, okay? Second is for the index finger. Third, middle finger. And fourth is for ring finger. Fifth is for little finger. Meaning, finger means it is pointing towards that direction. See, first one will be next to the thumb. Second will be next to the index finger. Third one next to middle finger. Fourth one next to ring finger. And the last one next to little finger. That's what I meant by telling the fingers. So they are numbered from lateral to medial, from the biggest finger towards the smallest finger. These are called metacarpal because they are in front of the carpal. Moving on to the phalanges or the phalanx, there are only 2 phalanx in the thumb, proximal and distal, and only 1 interphalangeal joint. Okay, the joint between the carpal and metacarpal is called carpometacarpal. Between the metacarpal and phalanx is called metacarpophalangeal joint. Between the phalanx we call it as interphalangeal joint. Whereas all the other digits have got 3 phalanx. You can see that proximal, middle and distal. When they have 3 phalanx, obviously there will be 2 joints. Proximal interphalangeal joint, and this will be the distal interphalangeal joint. This part is a distal. This will be the proximal interphalangeal joint. Obviously this is metacarpophalangeal joint. I will show you here. So this is the distal interphalangeal joint. This is the proximal interphalangeal joint, and this is the metacarpophalangeal joint. This one, metacarpophalangeal joint, proximal interphalangeal joint, distal interphalangeal joint. These interphalangeal joint are hinge type of synovial joint. Okay. Metacarpophalangeal joint is condylar type of synovial joint. Carpometacarpal and intercarpal joints are plain type of synovial joint. Okay. So the radiocarpal joint or the wrist joint is ellipsoid type of synovial joint. So these are the joints in the hand, the bones in the hand. To the distal phalanx is attached the flexor digitorum profundus, which flexes the distal phalanx of each digit. To the middle phalanx is attached on either side of the middle phalanx is flexor digitorum superficialis, which causes flexion of this middle phalanx. To the proximal phalanx, to the base, the palmar aponeurosis. Initially the palmaris longus is attached. Okay, initially palmaris longus was causing flexion of the proximal phalanx, but now because these 2 tendons are causing its duty, so it will become degenerative. The palmaris longus becomes degenerative to form a tight fascia, triangular fascia in the palm of the hand called as palmar aponeurosis. So anyways, the metacarpophalangeal joint is caused by flexor digitorum superficialis and profundus. So flexor digitorum superficialis and profundus itself will cause flexion of proximal phalanx. Flexion of the middle phalanx is mainly caused by flexor digitorum profundus. It can also be called as mainly caused by flexor digitorum superficialis. Can also be caused by profundus because profundus is going all the way up to the distal phalanx. Distal phalanx is flexed only by the flexor digitorum profundus because that is the only one which is crossing this joint. The distal interphalangeal joint is crossed by flexor digitorum profundus alone. The proximal interphalangeal joint is crossed anyways by flexor digitorum profundus but also by flexor digitorum superficialis to gain attachment to either side of the middle phalanx. The proximal interphalangeal joint is crossed by flexor digitorum profundus, superficialis and palmaris longus, which is now degenerative. So this area is caused flexion by 3 muscles actually: flexor digitorum profundus, superficialis and palmaris longus. These movements are abduction and adduction of finger. I have done separate videos on that. You can see that abduction, adduction by interosseous muscles. Independent abduction is caused by the little finger and the thumb, abductor pollicis brevis and abductor digiti minimi. We have separate muscle causing opposition over here. The opposition of thumb, pulp of the thumb touching the pulp of the other fingers. There is opposition by the little finger as well. So this is in detail about the palm. The palm consists of, hand consists of so many bones and joints and the muscles. Other videos you can see for the comprehensive knowledge. Thank you for watching and learning from Logic Medico. Kindly subscribe to our channel if you gain knowledge, and like this video and share this video with your other friends. Thank you once again.